So let's do it very quickly. Okay, it's just like it's of energizer and it's relating to occupation, business, and technology. So those activities linked with that we're doing. And I think I told you you can also come up with such energizers linked with the topic. So we go with the same theme. Okay, although it is a game, it looks like energizer. It looks like different. It has to more or less fit in within our theme of what we are doing.
Excuse me, sir.
Yes.
So just like one person will do the like acting, and we will have to guess it.
Yeah, you can guess it just for once only, but they that person don't keep on waiting for them to guess too many times. Just one guess to well, everyone. Okay, and then you just tell your occupation, because we don't want to give too much time on this energizer, spending 10 minutes, 15 minutes. Okay, just 3 or 4 minutes just for us to get refreshed, energized. Okay, so that you forget what was the thing before this class also, and then I can continue with my class full-fledgedly. But if you take 10 or 15 minutes, it's useless of the energizer. It's just to make sure we are having that energy to study next class. Okay, let's start. And it's fun also. Okay, like sometimes even we are seniors. At times we have been also doing in some workshops to different events. Okay, when it's too long classes, also it works out. Okay, so let's start alphabetically for now from behind for today. Yazat, just one acting quickly. Guess it quickly, others as quick as you can.
Singer.
Presenter.
Okay, now
Close.
yeah, Ruchit still okay.
News
Reporter.
reporter.
Yes. News
Okay,
report.
now Shriyat, let's do it quick as we can. Okay, Shriyat.
Sir, I joined a bit late. I don't know what we are doing.
Okay, Sonakshi.
So I'm not sure what to do. I kind of just joined.
Sen. I'll come back to them again. Eh?
Animator.
Manga publisher.
Writer.
Writer. Painter.
Oda.
Right.
Writer.
Writer.
Okay, now Sen, you can tell yourself. Make sure it is more clear so that they can guess quickly also. If you
Aruhi
speak,
is right.
sometimes your acting
Aruhi is right.
was not good enough for them to understand also, right?
Sorry, what did you tell, sir?
Aruhi was right.
What did she tell?
Writer.
Okay, Sen, that was writer, right? Okay, now next, Salish. Please turn on your camera.
Sir, I'm not sure what to do. Sir, my camera is on.
Yeah, I know it is on. Now, can you present one occupation which you are planning to do in the future or anything also? Any occupation that you like, anything.
Sir, I'm not sure.
Okay, I'll come back to you after some time. Okay, Rushan? Okay, Rushan, once you are ready, the person you can turn on your mic so that they know you're acting also. Okay, if not, they will not know what you're doing. You can turn on your mic also. You can speak, but don't say the occupation quickly.
Painter.
Painter.
Artist.
Okay, what was that?
Artist.
Artist. Okay, now next, Ruchit.
Yes,
Ruchit,
sir.
yeah, can you do your like mime of your occupation, acting?
Okay, sir.
Entrepreneur. What are you doing? Why is everyone doing writing stuff? Doctors?
Businessman.
Yeah.
Is sir paused?
Definitely fault.
Sorry, you are
Next,
mute.
next.
Who is after Ruchit?
Okay, those who are among this ready, can you raise your hand? You don't want to take too much time. I will not more than 5 minutes. We've already exceeded. Okay, let's continue with our class because it's already more than 5 minutes. Okay, now all of you fold your arms and sit straight and listen to me before we continue with the topic. So when I looked at few of the project works of both the sections, I found like some of the students had like just either written shown the education or the occupation, making a table. That was also fine to some extent. Whereas I'll show you that copy after some within some time, because right now I logged off because like electricity went off, and then I logged in from other device immediately, and again it comes. Okay, it goes and come, and I will show within some time. There, you what you have to do is not just make a chart. In that chart, some have written shown the uh, table where a person's name is there. That's very good.
Is it me or
Okay,
is all lagging?
am I lagging?
You were
Yes,
lagging.
sir.
Okay,
Yes.
because like it changed from data to Wi-Fi. Okay, right now the Wi-Fi again came back. Maybe during that interval. You can tell that. Okay, so right now the like as soon as it went, then data was working out, and during that intervention, that I think the bandwidth was not enough, speed was not enough. So you have to make that table and make an analysis. Okay, looking at that table, so the relation. How do you think education and occupation was connected there? Means higher education, is it showing better position and better remuneration to better facilities or not? Looking at those, it's just for you 10 people, although you cannot generalize based on 10 people because that is itself part of the your limitation, that whatever you research might not be enough to say because you're just told to do 10 people only, and doing a data of based on that might not be 100% true. Just looking at 10 people, you cannot generalize, but all it's making you practice that. Is that clear? But if you see not only yours, you see whole class, and then only you might make better uh, analysis. Means if you see others also in yours, then only you can make exact analysis what is the real thing. And everyone will be sharing their report, and I'll be keeping it one place so you can again see there and uh, see what is it really. So you can see the real world scenario exactly how is it going on. Okay, is it really making difference or not? For some it might be making, for some even though education is there, they might not be having good skills, then that's how they might not be lining up in good managerial position, a leadership position. Okay, so just trying to just see and analysis what difference is coming, or what type of training they have taken. Even though they have not taken academic, maybe they have better trainings, maybe they have better work experience throughout working for a long time. Maybe that's because even if they are working, they're learning, because we're all lifelong learners. Everyone is still learning, trying to move ahead, right? Okay, so maybe just try to analyze based on that data. uh, Analyze how much you can. Okay, I'll show you that table also if I can within some time, if possible. If not, that is what I've been trying to tell. And next thing, last class I had divided you into different groups to present. So are you ready with the presentation? You have to present it today immediately. You don't need to take more than 2 minutes for each group. Okay, first group, last time we explained about pharmacist. Which group is ready with pharmacist? Group A, I think, or which group I told?
Sorry,
Group
it's
A.
group one.
Yeah, group one. Everyone just get ready with your presentation so that they can also be ready. Meanwhile, I'll just tell some of the things so that you can all get ready. Opening those devices, and maybe like if one person's electricity goes off or if that person's thing is a problem, another person can be also opening that file as a backup. If that person is out of the room, then maybe another person has to continue immediately. Okay, if we keep on waiting, we will not finish on time. Exactly one person we told, and that person was trying to present, then there's a problem, like 2-3 minutes itself it goes. So we have to work on that. You have to keep a backup person. Okay, now I hope everyone is ready with the presentation. We'll go alphabetically and we'll go chronologically based on the book. Okay, now you can start your presentation. Group A. Pharmacist, like I've already also told to some extent, but presentation wise, we have 5 groups, and exactly 5 groups would get exact 5 topics. And it's yeah. Who has the file next? Can you show me the? Can you send me the link so I can present it from here?
Arohi, yeah.
Send me the link. I can present it from here itself. Right now, my electricity is already back again. But next time, I want
Oh,
you to.
I don't have the link in my phone. It's in my laptop. So now I don't.
Okay, we'll wait for you for some time. Then let's go to the next person for now. You can try to send me a link at least if you can. Let's not wait for that. Next, doctor.
Yes, sir.
Yeah, can you do a presentation? Meanwhile, she's ready with the link. At least if she gives me the link, I can ask another person to also present that. If my, like, if you keep it in the chat, then another person could also just like immediately do the sharing, like screen sharing.
Sir, can you see the presentation?
Yes, Edina.
So a doctor is a person who is qualified enough to treat people who have uh, diseases or who are sick. And doctors are the people who work in hospital, clinics, or medical centers, or they volunteer to do stuff related to the human body. Um, Doctors, you can find doctors of many types. Someone can be a surgeon, someone can be a psychiatric, someone can be a uh, like dermatologist, anything. And regardless of specialty, doctors face the challenge of diagnosing and treating human bodies that they are taught to or that they are qualified to treat. And being a doctor is not always the easiest, because no matter the time of the day or what they're going through, they always have to be there for the people, so that they can save the life of human being. So the educational qualification for doctors are normally a degree in MBBS or MID, and the minimum qualification should be 50% in grade 12 science and MBBS as well. and many doctors need to have the study of 4.5 years, and also an internship of 1 year. So this is the qualification that you need to have to become a qualified doctor so that you can work in the hospitals. Sorry, done.
Sir, you are in mute.
Edina, can you show that presentation still? You don't have to cancel it right now for now, because let them ask questions based on your presentation. We have to always have this. Okay, based on what you have presented, do you have any question, like any part there, like you don't understand what they have presented? Because if you ask good question, it shows good participation and effective participation. Okay, based on what is presented, they don't ask from things outside. Whatever they present, they have to understand and only present. Normally, most of the things they should be understanding what they are presented. Okay, one or two things, if it's connected there, I won't say anything, but whole thing that they don't understand and just present it is also not good. So anyone has any question that you didn't understand? If you understood, means she presented more or less most of the things useful over here for you. Okay, here if I see, can you go a little down? What is, okay, gynecologist? Others, any others, not only C, because you didn't ask a question right now. Others, what is a gynecologist?
Like a person who treats women's like pregnancy or something.
Okay, very good. Okay. So that's the thing. So similarly, you have different like obstetrician, all this thing. That is, rather than doctor, they're more into specialization. So that's why it says not written in detail. For that, that's enough. We have only regarding ophthalmologist. That is also a specialized degree. So you can see on page number 6. So you already know what a doctor is, and it doesn't need more elaboration. So normally, after finishing MBBS degree, you can keep on presenting. Okay, at least something is there to be shown to them, so that rather than seeing my face on it, they can see that also, and I can see them as well. So rather than so after finishing MBBS degree, then they are a general physician. Normally, we will be taking care of most of the normal diseases. Okay, and later on only you will be forwarded to a specialist after the physician checks it and identifies exactly what does it need in depth specialist, or the medicine is just normal case. So after finishing MBBS for 4.5 years and 1 year's experience, you go to that normally to those physician generally, and after that you have MD who is specialized into that, like ophthalmologist, gynecologist. Okay, little more into specialization. And in order to study this subject, it's asking for 50% in grade 12 science. So if you're in biology group, your subjects of biology group, which will be covering like subjects like, let's say like when I studied science ISC from St. Xavier's College, okay, intermediate in science, that was from TU. I studied generally subjects like physics, chemistry, biology, maths, English, Nepali. There was a subject like social studies, Nepal Parichai also during that time, which is now like itself compulsory for 11 also. Okay, so Nepal Parichai used to be there, and that. And so, but among that, normally in biology will be checked. Although math was there in first year of my study, second year I didn't study math. Although I studied, I didn't have to appear because that is distributed into physical group. One for the biology, one for the physical. Second year, if you are going to go to physical group to be engineer, then everything, then you have to take second year maths. And I took maths, but I didn't give exam. Okay, thinking it might be too much load to be looking after both of them. So, so that's how you study after plus 2, grade 12, MBBS. Okay, is that clear? So they'll be looking after they'll be prescribing medicines generally based on those condition. of the patients, normal cases. Now, next group, ophthalmologist.
Sir, like my electricity is gone and I was sitting in the desktop, so without electricity I cannot present it.
Have you submitted in the Google Classroom? That's why let's have a system before presentation date that you have already presented, like you submitted in Google Classroom. So at least I can try my best from my side when my electricity is good. Is it submitted in Google Classroom
Or
by
you
anyone?
haven't posted an assignment for this project working Google
Okay,
Classroom.
this then it's fine. From next time, I think we'll have to do that work to prevent, like, to find out the solution is. I will post that itself as a assignment in Google Classroom, and you send it before the presentation itself, so that I can also see what you're going to present before at times. Okay. So this is like it will just go next group. Another group. So for today, it's
Dentist.
yeah, dentist. If not, from next
Okay,
time
sir.
we have to start working so that we don't have this type of reasons and everyone is on a safe side. Okay. Even if someone is absent, other members have to be strong enough to present it.
Ruchit. So our topic is dentist.
Introduction to dentists. There are many jobs in the world. One of them is dentist. They are also known as dental surgeon. It is a healing art that is related with the teeth, organ, cavity, etc. A short definition of dentist. Dentist, one whose profession is to treat disease and injuries of the teeth and oral cavity and to construct and install retortations of and for the teeth.
The role of dentist. There are there is a huge role of dentist in our human life. They heal our teeth and they heal our cavity. Oh, they also educate the people about dental hygiene. They are the ones who are specialized in oral health. Some of the works done by dentists are as follows. They promote oral health and diseases prevention. They monitor the growth and development of teeth and jaws. They are involved in the diagnosis of oral diseases. They are involved in various operations related to oral cavity.
Okay, is it finished?
Qualification. So a dentist needs a qualification of diploma in dental science or dental hygienist. They at least need to pass SCA or grade 10 to get this to work on this degree. This it takes about 3 years to get this, and for both as well as they also have can get a degree of bachelors of dental surgery or doctor, and they need for to obtain this to obtain this degree you at least need to have 50% biology as main subject in class 12. It is about 4.5 years of study and at least 1 year of internship. Both of these degrees have a basic subject matter of anatomy of head and neck, oral environment, dental tissues, nutrition, etc. Any questions?
You can go back to the slide so that they can see and ask question as well. So from first slide itself, anything? Okay, do you have any question regarding what they have presented? If you ask them, then they'll explain. If they can't explain, then I will also try to explain based on what is at least minimum needed for our curriculum to what is your query also, okay? But first, we can ask them, and after that, I will support them if they will not explain things that is needed at least for our level. Okay, so I don't think they have much questions regarding that, but can you, like, do that presentation itself? No. I mean, so go to that first slide, this second slide, third one, third slide. Okay, so from here I'll just be explaining. Third one, just little before this. Okay, so he has already written about what is a dentist. So normally the dentists are the people who are working relating to oral cavity. What is oral cavity here, Jason?
Sir, oral cavity means the area of our mouth and all surrounding area of our teeth.
Okay, very good. So all those areas around oral cavity, if it is anything relating to oral, if you hear that word, it's relating to the mouth. Anywhere you see that word called oral in science part, it's trying to say it's relating to the mouth. Is that clear? So within that area, so all the teeth area to everything is going to be covered on by the dentist. And you know, this has a good scope. The dentists are sometimes like you have to pay a little higher, I think, for dentist also. They have a good scope as well. This
When
profession.
we eat too much chocolate.
Yeah. So yes, Ruchit, what did you say?
So when you eat too much chocolate.
Then
And
you
sir,
have
because many people don't
because
seem
like
to
there
care
are
about their oral hygiene now.
because like there are different germs in the teeth, and because of those things, then you'll have to meet the dentist. If not treated on time, the teeth is going to be damaged, and slowly, if once most of them are damaged, then you have to either replace with artificial, and artificial are not strong. Normally, they're not strong
Sir,
enough.
and sometimes because of those germs, it can be fatal.
Yeah. So that's why this you have to really meet the dentist, because you have to eat, isn't it? And you have to make sure it looks good. Some are showing right, keeping braces so that it looks good to them. Okay, and some of them can't even show their teeth because it's looking all. These things are also looked up and after by the dentist just to fix them also, including keeping other like hygiene of the teeth and any disease prevention. When you go for a checkup, then they will see what is the condition of the teeth and will help in various operations of the teeth, whether it be taking out, whether it be keeping new teeth or anything. That's what a dentist is going to do. So next, regarding the degrees, go to the next page. He has also told. Next page. Okay, here first immediately after SE, after grade 10 also you can study directly. Go to that. Yeah, immediately after SE also you can directly go and study diploma in dental science without studying 11 and 12. For that will be continuously for 3 years. Okay, and same way after +2 science and you have taken biology as the main subject, like I told you, I took my biology subject, not physical, and I was not allowed to go to the engineering field even if I was interested, because I had not taken second year math. If I had taken second year math, then I would be allowed to at least give out a try if I was interested. Okay, but I had to be interested at that time. Okay, and so grade 12 after that also, then you can go to direct bachelor's of dental, or diploma also can come and study bachelor's after that. Is that clear? Either you can go to SE and diploma in here, or you can study biology or go to this bachelor of dental surgery. And this bachelor's of dental surgery is going to take 4.5 years of study and 1 year internship. And where you will be studying anatomy of hair and neck, because that's linked with the teeth, with the anatomy of hair and neck, that's connected. So you have to study those connected places as well. Oral environment and dental tissue as well, and nutrition. So this is the qualification required for a dentist. It has a good scope. That's what we have been telling. It is nothing so difficult. Okay, now next group. Nurse? Last group?
So just a second, we are having a little bit of technical problems.
Okay. Meanwhile, they are coming. I will present you few things from my entire screen. Why wait for them? Okay. I'll let them just get organized. Okay, can you see this? Edina's assignment came at first itself. Okay. Edina, don't get shocked. Okay, you can just see. It's not I'm trying to tell only of Edina. I liked it immediately. You can see the table, name of the person, occupation, works related to profession, qualification, and service holder. All these criteria were kept based on what sample I get then, and the sample I gave them was also not of the level of grade at what I expected, of what I expected, although that is fine, but my expectation was little more than this. So you can see here in the question, you could keep some more columns. Okay, have a conversation or schedule a questionnaire with 10 at least working people or managerial position people, where you could keep in that table name of the person, education indicators such as how much qualification, diploma, what grades did they get, what course they took, what experience they have, what academic qualification or education qualification they have in one side relating to education. Next side, you could keep occupation such as what position they are in, what post they have, what salary or remuneration they have, if they give you only. If they don't give you, then that's a limitation during our research. Is that clear? This type of limitations come when you conduct research. When you go, everyone will not tell the answers because that is itself part of limitation, and you have to find ways how to get that information. You cannot force them. You have to learn to be diplomatic to even get that answer at times. Is that clear? And
Yes, sir.
and after that, I'm not telling only AD9, I'm telling everyone. All these things could be kept on one side, just the education, one side, all relating to occupation. And so connection, like how much you see the connection, higher level qualification, higher level position, or what is it? Although just doing research of 10 people and making conclusion is not a good generalization. You have just taken 10 people of Bhaktapur area, not of whole Nepal or whole world, isn't it? But this is itself teaching you how to conduct research and make analysis. Is that clear? Just based on 10 people, I cannot say you to collect 50 people. Even the people who are doing thesis, they might not collect normally around 30 people also, they might just collect maximum. But their questionnaire might be longer, not just 4 or 5 indicators there. Is that clear? Okay, now let's continue with the next group. Are you ready?
So just a minute.
Okay, I wanted to utilize their time. Okay, so they have already presented of dentist. I'll talk about ophthalmologist right now. Go to page number 7. Look at your book. Meanwhile, she gets ready. I'll finish that topic. I'll not be waiting too long for them. Page number 7. So in ophthalmologist, it's relating to eye. Like we told, like Dr. Sandeep Ruit is an ophthalmologist who has been able to look after eyes problems since a long time, and social service relating to giving eyesight to many people at also very cheap cost or even free of service. Okay, that's why he's known for that community service and social work as well. He's a renowned person for our country, and I didn't know that when I was in the school time, although his son was in the same school, one batch junior. Okay, afterwards only I came to know about his contribution. Once, like I was in the studying at around bachelor's level, then only I came to start knowing his contribution. Okay, and you have studied about him also in, I think, some of the books like Nepali also it's been mentioned. Even in social studies in some of the places it's been starting to being mentioned in contemporary issues. So these are the medical doctors relating to eye and vision. So optics is relating to eye. And normally these things are in biology also, and you have in that physics also, optics, where you have to calculate short-sightedness to far-sightedness and all those defects of vision, myopia, okay, hypermetropia, what is that, okay, calculation of that to everything will be studied in this, and they'll be treating those eye infections, treating with the vision problems. And you know what is farsightedness and what is short-sightedness? What does that mean? Okay, all of you turn on your camera and look at the screen. What is farsightedness and short-sightedness? These terms you might be studying in physics also. Okay, it's all relating to whether you if you cannot see far, that is far-sightedness. If you cannot see near, that is short-sightedness. Some cannot see near, some cannot see far. So based on that, you get a spectacles, either it be positive or negative, so that the lens can work out so that you can see that vision clearly. Some cannot see near, and they have to make sure it forms an image inside their eye exactly at the place where it needs to be forming the image. So to fix that, they have a lens with certain power, so it goes and exactly makes like image over there, and so you can see that clearly. So that's type of things are also done by ophthalmologist to everything, studying that and finding out the problems relating to that, so they can help to prevent blindness or even other problems of blindness. Recently, like there are some, I don't know what is that, one thing, black fungus along with corona or something affecting the eyes itself. That's what is showing some connection. So next, let's go to nurse over there. So next one is nurse. So nursing is itself relating to medical field over there. So in case of nursing, they are the people who will be normally assisting with the doctors so that they can check out the blood pressure, fever, normal cases of the patients. Okay, helping normally the women in the pregnancy and post-pregnancy. Okay, during that pregnancy time to after taking care after the pregnancy as well, and giving the patients also medicine on time. So these things are normally done by a nurse in the hospitals, and not only just hospital. They might be working in different places as well, in communities also. Okay, community health, so working in the community to provide proper health care, doing some awareness activities relating to health, to giving medicines as well. The nurses will be also doing. And there are two types of nurses over here. One is ANM. ANM stands for Assistant Nursing Midwife. So when you say midwife, it's itself linked with what do we mean by midwife? So midwife is relating to contents such as pregnancy itself. Okay, so on ANM, Anami, that they say in Nepali, they are also registered nurse. You can study that after SEE. Immediately after grade 10, you can study ANM also. You can study staff nurse also. Staff nurse course is little longer, 3 years, and ANM's course is 2 years and 5 months. You can see that in educational qualification. So staff nurse and ANM, more or less scope might be in case of staff nurse at the moment, I think. Although we have enough staff nurse that most of them are not even getting good jobs in hospital, because more and more nurses are already being produced in the country. And normally they have a good option is to go to countries like Australia and work out in the elderly, like taking care of the elderly people. Okay, so that's regarding nurse. And in that you can see subjects like human body, pregnancy, treatment of normal disease, medical take care will be done. Can you see that educational qualification? Okay, do you have any question regarding this nursing career? Can you see that paragraph and just ask me immediately if you have anything? Okay, now go to page number. Those who, even if you don't present, I'll continue the topics. Like if you're too late, I'll just continue from my side. Page number 20, medical profession. Whatever are the questions over there, left behind questions will be kept in your Google Classroom. And for everyone, tomorrow you have to present for that provinces. It doesn't have to be too long, 2 to 5 minutes averagely. Whatever is their content, you have to just try to present that only. Is it clear?
Yes, sir. Thank you,
Yeah, but
sir.
like there
Bye
are,
bye, sir.
okay. And today, if you have still not finished, please make sure you're there at 5 o'clock and finish it. Okay, if you need my support, not 5, 4 o'clock. Tomorrow we have to present it, yeah, all the groups, and please submit it by today evening. Thank you. Could you please leave the classroom? Adrian,